The 7 weird skin signs of diabetes. Have you ever noticed unusual changes in your skin that you couldn't quite explain? Perhaps it's a patch of darkened skin in a fold, or maybe you've developed some small bumps that weren't there before. While these changes might seem harmless at first, they could be your body's way of signaling something more serious: diabetes. Diabetes is often thought of in terms of blood sugar levels, but did you know that it can also manifest through changes in your skin? Today, we're going to explore 7 strange skin signs that could indicate diabetes. Understanding these signs is crucial because they might be the first visible clue that something is off with your blood sugar levels. So, if you or someone you know has been experiencing any of these skin issues, it might be time to take a closer look. 1. Acanthosis nigricans. Let's start with Acanthosis nigricans, a condition that causes dark, velvety patches to appear on the skin, usually in areas where the skin folds, such as the neck, armpits, or groin. These patches might look like they're just a bit of extra dirt or might feel slightly thicker than the surrounding skin, but they are actually a sign of high insulin levels. When your body has more insulin than it can use, it triggers the skin cells to grow faster, leading to these darker areas. While Acanthosis nigricans can be associated with obesity and hormone disorders, it's often a sign of insulin resistance, a precursor to diabetes. If you notice these patches on your skin, it's important to consult with a healthcare provider to get your blood sugar levels checked. Early detection of insulin resistance can help prevent the onset of type 2 diabetes. 2. Diabetic dermopathy, shin spots. Next, we have diabetic dermopathy, also known as shin spots. These are small, brown, oval-shaped spots that typically appear on the shins. They might look like age spots or scars and don't usually cause pain, which is why many people might overlook them. However, these spots are actually linked to changes in the small blood vessels in your skin, which are often a result of diabetes. Diabetic dermopathy occurs when the blood vessels are damaged, leading to a reduced supply of nutrients to the skin, which then causes these spots to develop. While they are harmless, their presence can be an early indicator of diabetes. If you notice these spots on your legs, especially if you have other risk factors for diabetes, it's a good idea to get checked out. 3. Digital sclerosis. Another peculiar sign of diabetes is digital sclerosis, a condition that causes the skin on your hands and sometimes your feet to become thick, tight, and waxy. This hardening of the skin can make it difficult to move your fingers or toes, leading to stiffness that can be quite uncomfortable. Digital sclerosis is more common in people with type 1 diabetes and is believed to be related to circulation issues caused by high blood sugar levels. When blood circulation is impaired, the skin can't get the nutrients it needs to stay soft and supple, leading to this thickening. If you've noticed that the skin on your hands or feet has become unusually hard or stiff, it's essential to address it with your doctor, as it might be linked to your blood sugar levels. 4. Eruptive xanthomatosis. Eruptive xanthomatosis is a lesser-known but very telling skin condition that can signal diabetes. This condition is characterized by the sudden appearance of small, yellow bumps surrounded by red halos, often found on the feet, arms, buttocks, and hands. These bumps are actually deposits of fat that accumulate when your blood cholesterol levels are abnormally high, a condition that is often linked with diabetes. Eruptive xanthomatosis tends to occur more frequently in individuals with uncontrolled diabetes or those with high triglyceride levels. While the bumps themselves aren't usually painful, they can be itchy and uncomfortable. More importantly, their appearance is a sign that your diabetes might not be well managed. If you see these bumps, it's crucial to get your blood sugar and cholesterol levels tested as soon as possible. 5. Fungal infections. People with diabetes are also more prone to fungal infections, particularly those caused by the Candida fungus. This yeast-like fungus thrives in warm, moist environments and can cause infections in areas such as the mouth, thrush, between the fingers and toes, under the breasts, and around the genitals. Fungal infections often present as red, itchy rashes, sometimes with small blisters or scales. The reason people with diabetes are more susceptible to these infections is that high blood sugar levels can weaken the immune system, making it harder for the body to fight off infections. If you're experiencing frequent or persistent fungal infections, it might be a sign that your blood sugar levels are too high, and it's important to seek medical advice to address both the infection and your blood sugar control. 6. Slow healing wounds. Another serious skin sign of diabetes is slow healing wounds. If you have a cut, sore, or blister that seems to take forever to heal, it could be due to high blood sugar levels affecting your circulation. Diabetes can cause blood vessels to narrow and harden, reducing blood flow to the affected area. Without adequate blood flow, wounds receive less oxygen and fewer nutrients, slowing down the healing process. This not only makes you more susceptible to infections, but can also lead to more severe complications if left untreated. If you notice that your wounds are healing more slowly than usual, it's important to see a doctor to check your blood sugar levels and ensure you're managing your diabetes effectively. 7. Skin tags. Lastly, skin tags are another common but often overlooked sign of diabetes. These small, soft growths of skin can appear anywhere on the body, but are most commonly found in areas where the skin rubs against itself, such as the neck, armpits, and groin. While skin tags are generally harmless, they can become more prominent in people with diabetes due to the higher levels of insulin circulating in the body. Like Acanthosis nigricans, skin tags can be a sign of insulin resistance. If you've noticed an increase in skin tags, especially if they appear suddenly or in large numbers, it might be worth getting your insulin and blood sugar levels checked. Managing your blood sugar can help prevent the formation of new skin tags and reduce the risk of developing diabetes-related complications. Diabetes is a complex condition that can affect your body in numerous ways, including your skin. These 7 unusual skin signs, Acanthosis nigricans, diabetic dermopathy, digital sclerosis, eruptive xanthomatosis, fungal infections, slow healing wounds, and skin tags, can all be early indicators of diabetes or poor blood sugar control. Recognizing these signs is crucial because early detection and management of diabetes can prevent more serious health problems down the line. If you've noticed any of these skin changes, it's important to take them seriously and consult with a healthcare provider. By addressing these symptoms early, you can take control of your health and prevent the complications associated with diabetes. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe to our channel for more health-related content. Your skin might be trying to tell you something. Listen to it and take action today.